Good afternoon, everyone. Thanks for joining us for today's virtual office hour. This project is funded by the U.S. Department of Labor's Youth Apprenticeship Intermediaries project. And so our topic today is the future is health, building youth apprenticeship programs in healthcare. And our wonderful esteemed presenter today is Claire Hines, the founder, CEO, and president of NetAmerica. And so with that, I'll go ahead and turn it over to Andrea. After I make this quick announcement, please note and remember that this session will be recorded. So if you're not the primary speaker, we do request that you will keep your phone line muted for best call quality. However, we always welcome your input. So feel free to pop any questions or comments in the chat, and there will be plenty of time for live Q&A. And if you want to know where this will live afterwards, there'll be a note at the end for you to find us later. So with that, I'll turn it over to Andrea. Andrea?
Hello, everybody. Thanks so much for joining us for our virtual office hour. I'm joined today by Claire Hines from NetAmerica, and I've had the pleasure of working with Claire over the past year and a half on our Youth Apprenticeship Intermediary contract that is funded by the Department of Labor. And so with that, I will turn it over to Claire to talk to us about building youth apprenticeship programs in healthcare.
Wonderful. Good afternoon, everyone. And thanks, Andrea. Thanks, Cassandra, for inviting us. It's always a pleasure to be able to work, with colleagues like yourself. I think, these kinds of collaborations really go a long way to strengthening both our collective approaches to our intermediary efforts. Joining me today is actually the director, our newest director of the Youth Apprenticeship Intermediary, Mr. John Short. But I'll start, and just make some introductions. I'm not sure, folks who may be online or who get to listen to us during this lunchtime chat, I like to call it, whether they're very familiar with industry intermediaries as a whole and exactly what we do. But I'll just start off. Cassandra, next slide, please. So my name is Claire Hines, President and CEO of NetAmerica, and who also happens to be a glutton for punishment as it relates to being passionate about intermediary and apprenticeship kinds of efforts, including training and just the whole cycle of learning opportunities and providing such opportunities to youth and particularly underserved and marginalized populations. And with me this afternoon is John Short. So John, if you just do a quick introduction, and then I'll run through my little piece.
Sure. I'm John Short, formerly with other apprenticeship entities like Home Builders Institute and with the National Restaurant Association Education Foundation, and I joined Claire on October 1st to work with her on both the Youth Apprenticeship Program and the ERAP program, which is expanding our registered apprenticeship programs. And I'll hand it back to you, Claire.
Absolutely. Thanks, John. We won't hold it against you about your prior relationships, but welcome. So NetAmerica's, our overall mission as a DOL intermediary, and particularly for today's event, a youth intermediary, is to support and expand registered apprenticeship programs regionally. And our region that we work in particularly is the Mid-Atlantic region, which includes Washington, D.C., Maryland, New Jersey, Pennsylvania, Delaware, which I know JFF has quite a footprint in. And then it's just growing. And so with partners like JFF and others in the youth intermediary space, and of course DOL's investments, these initiatives are growing and expanding exponentially. And so NetAmerica is a small organization. Next slide, please, Cassandra. NetAmerica is a small, what they call an economically disadvantaged woman-owned small business. And so what that does is gives us a little bit of a different bird's eye view, if you will, into some of the issues surrounding marginalized communities and that are particularly impacting the youth in those areas. And so we do actually pride ourselves and pay particular attention to youth and how we can support them in registered apprenticeship programs to understanding that they have additional challenges that might not be readily visible if you are not in those communities, or if you're just not aware of some of the challenges that are not typical in typical youth kinds of programs. Some other work we do that actually provides strength to our registered apprenticeship and intermediary work has to do with our other professional services. We've been around for 21 years, and so we understand what it's like to manage these kinds of efforts and how critical it is for results. Next slide, please. And so what is a youth intermediary, right? And so again, as I was saying, what our goal is primarily is to partner employers, if there's some on this call this afternoon, with youth that are interested in registered apprenticeship programs. We can support employers to register programs, develop standards, assist with that, and bridging, really, it's like a bridging partnership between yourself as an employer, as an educator, as a student, with a program that fits within the auspices of a registered apprenticeship program. And by that, I mean, it's got to follow certain DOL rules and regulations. And the reasons that those rules and regulations are there is to provide some uniformity across the country, so that when we say it's a DOL registered apprenticeship program, employers, students, educators can rest assured that there's consistency throughout the country, regardless of industry that the registered apprenticeship program speaks to. But today, what we want to really have a chat about is our healthcare futurist health intermediary efforts. And so the contract, similar to what JFF has, started in June of 2019. And as you recall, that was when life was good. No one really even knew where you bought masks because it was pre-pandemic. And so we started off all gung-ho. We actually got several, I think about 12 different standards approved with some employer partners throughout the Mid-Atlantic for healthcare occupations for youth. They ran the gamut. For example, we have a community healthcare worker youth apprenticeship program in New Jersey that was targeting youth that were in between high school and community college kinds of timelines, and they were ideal for these kinds of programs. There's another youth one for healthcare, but in the housekeeping kind of space, as well as sanitation kinds of healthcare related occupations. And so fast forward 6 months from when we started the contract, the pandemic was becoming a thing. And as everyone in this space, and you, I'm sure, on this call also possibly experienced, our lives came to almost a screeching halt until we could figure out what our new normal was. But nonetheless, in our position here as an intermediary, we've met so many fantastic employers, educators, students, and potential apprentices who were still committed to this goal of either developing a registered apprenticeship program in healthcare, participating in one, training healthcare occupations for a registered apprenticeship program. And so we persisted and continued to support employers like yourselves and develop programs. And later on this afternoon, we have an employer joining us. And, we invited them to chat with us today because they did something very unique. They realized right again where, as the pandemic was hitting, because remember now, if we're supporting youth of between ages 16 and 21, we're already security issues with having youth coming into a healthcare related workspace at the best of times, never mind during the beginnings of the pandemic as we found ourselves. And not only were youth not allowed to enter a hospital or medical facility, no one was allowed to unless you were either working there or unfortunately you were being admitted for COVID treatment. And so the organization that you'll hear from this afternoon is called Healthcare. Oh my God, I'm missing it. HCSG. healthcare services group. And what they did was they had a unique position of having a national footprint. And I want to say they had probably like 90 different locations where they were serving youth as well as other individuals, but also there were youth in the portion of employees that they were serving. And so they developed a registered apprenticeship program in the, what's the term, John? I'm drawing a blank.
Sure. Both food services,
The food services.
management.
Exactly. I'm sorry. Yeah.
Environmental management.
Yeah. And we were so delighted with that innovation, because when you think of it, when we think of healthcare, clinical services were literally, and training for clinical services either, again, came to a screeching halt or just absolutely non-existent. And so they then pivoted to non-clinical services. And so the occupation that they'll describe, or maybe John can mention a bit more about it, is it did not require being in front of a patient or being, in the hub, if you will, of hospital services, medical services. And so that's how they were able to get some success with that. But before they come on, so next slide, please. So I'll hand it off to John just to give a quick, we're about 2:11 p.m., John. So to just give some background on healthcare occupations and where they are, today, as well as some data points that he wants to share with you. And then hopefully by then our employer will have jumped on, and then we can get into some real details about how their program is going and how, and what made them even pivot to that non-clinical role that is a big success for them. John?
Thanks, Claire. It is no secret that our population is aging. The Census Bureau provides wonderful data, and I'm just going to give you a few statistics. In 1960, the 0 to 14-year-old population in the United States was 30% of the total population. And those that were 65 and over was 9%. Fast forward to 2020, the 0 to 14-year-old population is 18%, and 65 and over is 17%. In comparison to the European Union, which is 21% of 65 and over, and Japan, which is 28%, who are 65 and older, you can see that there's going to be a critical need for healthcare workers. So I pulled off data from the Bureau of Labor Statistics on occupations that do not need a college degree. So we focus heavily on these occupations because a lot of the training can be provided at your career and technical education centers in high schools. Remember that the age group that we are working with in youth intermediary grants are between the ages of 16 and 21. So typically we're talking about in-school youth, both at secondary education and in post-secondary and community colleges. So when you look at the data, some really interesting things are happening. One that I did not include there was pharmacy tech. And the outlook for a pharmacy tech is not good. Projected over the next 10 years to grow by 4%, which is way below average. And the reason for that, I'm guessing, would have an awful lot to do with people being able to fill their prescriptions online. When you have CVS, Walgreens, Amazon in that space, the necessity of having a live human being filling out your prescriptions, if you're in an urban area, is greatly diminished. You will, I mean, we have come across pharmacy tech programs in youth apprenticeship, but more in rural areas where you do not have a CVS or a Walgreens or the like. But if you look at the occupations we have listed here, the LPNs, licensed practical nurses, and surgical technologists, they're the ones that have the highest wage. And if you scroll on back to home health and personal care aides, there is the most demand, 33% expected increase in the number of this occupation over the next 10 years, but it also has the lowest wage, you know, at 27, our median wage at 27,080. So what we have done working with different groups, particularly a group in West Virginia, is to develop a patient care technician program. And it includes phlebotomy. It includes an EMT paramedic, all of these different basic life support, all of these different industry credentials that can lead to a licensed practical nurse. So this is part of the career pathway. If you take the individual occupations but join them together into a registered apprenticeship program, we will have more of an opportunity for success than if we just train for the individual occupations themselves. I mean, the outlook is very bright in the healthcare field. And, you know, it's from state to state, it's kind of different. Like in state apprenticeship agency states like Maryland, they require a youth apprentice to commit to 450 hours of on-the-job with the employer per year. Virginia requires 250 hours. The Office of Apprenticeship, unfortunately, has not provided guidance to the OA states. So that's kind of a free-for-all. It's whatever you can work out with between the employer and the school system, or the employer and the community college. I wish there were a little bit more guidance there. It would be helpful.
Yeah, I agree with you there. I think we all experience that. But for sure, you know, it is a bright outlook. And I think if anything else, we, or nothing else, the work that we're doing with the Future is Health campaign is more than we can handle at this point. However, we're certainly excited, and the more that we partner with organizations like HSG, I believe, so I'll introduce you. So next slide, please. The employer that I wanted to highlight today and just have a quick Q&A session with him, Mr. Ramel Biscoco from Healthcare Services Group. Hi, Ramel.
Hi, Claire. Can you hear me okay?
Thank you so much for joining us this afternoon. I really appreciate your time. And I know it's only a 30-minute period, but I do want to get to some quick Q&A that I think would be helpful to some of the other the callers or listeners on the call today. And, you know, one of the biggest things is, you know, how or why and when did you start the registered apprenticeship programs that we're discussing?
Sure. Thank you, Claire. And hello, John. Very nice to meet you as well. So we've been looking over this. Jeannie Fissinger, who you've had a chance to speak with, she's our Senior Vice President of Training and Policy Development. She's been working on registered apprenticeships for a number of years now. And the review, I think, came really just to fruition this year, early January this year. But the why, right? Our candidate volume, you know, the healthcare industry, there has been and continues to be a need for management personnel in this industry, right? Claire, thank you for the opening earlier. As far as for our services, we're a partner within the industry here, providing management to the housekeeping, laundry, dining, and nutrition services within the healthcare facilities. And, you know, HCSG, we have many instances of a promote from within type of career progression. There are many corporate and field leaders that have experienced this, myself being one of them. You know, I started my career with HCSG as one of the environmental services managers in training. That was the name of our development program, and still is currently today, before we've also introduced the registered apprenticeship training program for management. You know, and the why to your question, as we continue to recruit qualified candidates for our management roles, it was clear that we have many talented and dedicated field associates that we could present similar opportunities to. and we've developed the registered apprenticeship programs to organically train future leaders with HCSG.
Wonderful. So then, you know, when you were developing the standards and or getting the work processes approved, was it difficult, or how long did that process take for you? And then was it difficult to start your in-house training program?
So that's a good question. So as far as the time frame, again, like I had mentioned, Jeannie had been working on this for a few years now, and it was a matter of engaging, you know, the right individuals out there to recognize, right? The process when I was introduced to this here was probably about fourth quarter of 20, and then probably trying to get it off the ground took another 4 to 6 months. You know, there's a lot of prep work that went into it. A lot of things that we had already had in place. You know, we've had a training program for over 40 years now with the organization, but it was a matter of how do we refine that? How do we have that fit, you know, to our new candidate audience of the registered apprentice?
Exactly. I mean, these are real hard numbers that employers need to really understand, that there is some development time involved. And so NetAmerica, as the youth intermediary supporting HCSG and the incentive funds that we provide to your apprentices, how has that helped in your journey?
Oh, that's good. You know, so for us, it was about, you know, how do we support the registered apprentices, right? Technology. Our organization uses quite a bit of technology to manage our business, right? From payroll management systems to purchasing to recruiting to personnel, and specifics on the dining side as well. That was hardware, right? Computers, devices for us in order for us to deliver our training content. So that's what we've been able to see the benefit from this, is that it was a support in us being able to provide those devices to our field teams, to our journey workers, to support the development of the registered apprentices.
Excellent. And we're certainly glad that it's making an impact. You know, I think as things got really crazy, you know, and it's still crazy, you know, 2021 and then almost into 2022, you know, certainly happy to hear that. I'm just kind of scrolling through the chat, make sure I catch questions in there. One question is, what advice could you give to healthcare employers who might want to have a youth apprenticeship program?
There's planning. There's quite a bit of planning, right? Understanding your audience, your candidates. You know, we typically have been trying to recruit a qualified candidate, right? An individual that has the knowledge and skills and abilities of what this job description would entail. The registered apprenticeship is a much longer program than our typical management and training program, right? It being a 12-month or an 18-month progression, there's a lot more time to develop, right? If an individual may not have the qualifications or the KSAs in the market that you're searching, they should be considered, right? This time, we've been able to refine our development that we're providing. You know, if they didn't have those qualifications and KSAs at the front end of their career, we're providing that to them in that 12 to 18 month progression. You know, I would certainly ensure that if opening an apprenticeship, make sure it ties back to your company, to your company's culture, your purpose, and create that connection with the registered apprentices. The engagement that my team of people development managers provide to our registered apprentices and our journey workers has been showing and yielding tremendous feedback. You know, we hear the stories from our existing registered apprentices. I feel the positivity that is coming from them, the different like boost of confidence that they have in their current positions, but I see that carrying into the larger level positions as I advance to the management positions.
Excellent. So then, you know, you mentioned in that answer some issues or thoughts around make sure you understand your audience and your recruiting practices. Did you find that you had to have different recruiting approaches for youth that were coming in or youth employees or apprentices, or was it just a blanket recruiting approach and then, you know, you just caught a certain percentage that were youth?
We actually had a blanket approach. You know, when we started the selection process, that was an interesting process for us. I was absolutely touched by seeing and hearing some of the stories because we asked every single person, we said, what does this apprenticeship mean to you? You know, we designed the program, we explained thoroughly what it would entail and what their life would look like, what their career would look like with us in 12 months. And hearing from them, we didn't change our approach, whether it was someone that was a youth apprentice or someone that was in the equity bucket. You know, we interviewed everybody, and the approach with the youth, to see the excitement, to even see, actually be able to meet and see the faces of them during National Apprentice Week. You know, there were another candidate that was equally considered for this position, you know.
Wow. That's wonderful and really heartwarming for us to hear as well firsthand, because you know we're all working at, when those of us that are working in this space from an intermediary standpoint, we don't necessarily get to meet all those people that you interview and recruit and approve to get in the program. So thank you for that.
Absolutely.
I see some more questions. How are we on time? Okay, we've got a few minutes. Do you happen to have any apprentices that are enrolled in high school when you meet them? Or are they graduated or in community college or just out of school youth?
Yeah, we currently have two youth right now. The graduated though, none that are currently in high school.
Okay, great. Yeah, one of the pushes that we focus on too is, you know, the whole diversity, equity, inclusion, and access, and particularly out of school youth. Of course, DOL, you know, again, is really pushing for us to make sure we don't lose that group. And so internally, we've been developing and crafting specific targeted and marketing approaches to reach those folks as well. But it's good to hear, you know, that your folks are excited. And, you know, we certainly look forward to hearing more stories as your program unfolds or unfolds. You know, I also try to explain to folks that may not be familiar with the whole registered apprenticeship cycle, because as you said, it takes time to develop and plan these programs. And even when that happens, it unfolds over, you know, long periods of time, months, years, because the program doesn't just start and stop, it's ongoing. And recruitment is often in batches and cohorts, just like it is in schools or universities. And so we do try to share that. Let me see if there are any more questions. John, I'm not sure if you wanted to ask Ramel anything. Oh, you're on mute as usual.
Actually, Claire, we're just bumping up against time, so I think
Yes.
we might need to wrap it up for today.
Okay. Oh, wonderful. Well, I don't know. You know, I felt like it was just 10 minutes long, but understand. Thank you so much for the invitation. And I think this is being recorded, so you know, if there are any other great questions that anyone has, of course, please reach out to us, and we'll be happy to share information and you know, respond as soon as possible. Over to you, Andrea.
Sounds great. Thank you so much. And thank you for all of the great information. I did capture some of the questions in the chat. And so we'll be able to reach out to folks. I'll pass that information back on to Claire so she can reach out. With that, I'll let Cassandra wrap us up.
So thank you guys so much, NetAmerica, for that great presentation and for bringing in Romel in order to bring the employer's perspective. So this recording, along with other recordings from our virtual office hours, are part of our Youth Apprenticeship Works community of practice. And so if you're not yet a member, feel free to reach out to me so I can connect you into those. Please stay connected with us as we host additional ones on topics that should be of interest to you as you look forward to expanding your youth apprenticeship programs. So thanks again, everyone, for joining us, and we'll see you next time.
Thank you.
Thank you.